Now, in this particular group of drugs used in the treatment of glaucoma, if you take this particular glaucoma, we have the following types. We have primary open angle glaucoma and as well as the angle closure glaucoma. Now let me tell you which are the drugs which are useful in primary open angle glaucoma. Right, drugs which are useful in primary open angle glaucoma. Okay, so if you see the drugs which are useful in the primary open angle glaucoma, let me tell you what are the drugs. Among all the various groups of drugs, the first line drugs, right, I am not telling the drug of choice, the first line drugs for the primary open angle glaucoma is your beta blockers. So beta blockers, they are the first line drugs in primary open angle glaucoma. Next, now let me tell you the mechanism, right? Let me tell you the mechanism. Actually, we use the beta blockers. We also use the alpha 2 agonists. Why do we use these beta blockers? Let me explain you. Now, within the eye, like we have what is called as the ciliary process. Right, within the eye, we have what is called as the ciliary process. This particular ciliary process, it has the two receptors. One, it has beta 2 receptors and the other one is the alpha 2 receptors. You take the beta 2 receptors. Whenever the beta 2 receptors are stimulated, there is vasodilatory action. Right, there is vasodilatory action. When alpha 2 receptors are stimulated, right, when alpha 2 receptors are stimulated, there is vasoconstrictor action. Okay, so when beta 2 receptors are stimulated, there is vasodilatory action. When alpha 2 receptors are stimulated, there is vasoconstrictor action within the ciliary process. Now, whenever there is vasodilatation, remember this point, whenever there is vasodilatation that occurs, what will happen is the amount of blood reaching the ciliary body, it increases. Okay, so amount of blood reaching the ciliary body increases. Okay, now as the amount of blood reaching the ciliary body increases, that will result in excessive secretion of the aqueous humor. Right, that will result in excessive secretion of aqueous humor. Okay, next. Now you see here, that means when the beta 2 receptors are stimulated, there is more and more aqueous humor production. So what you try to do is, you try to block the beta 2 receptors, right? You try to block this particular, the beta receptors, right? Once this particular beta receptors are blocked, the aqueous humor production will be reduced. So therefore, right, therefore, remember the beta blockers and as well as the alpha agonist will decrease the secretion of the aqueous. So beta blockers and as well as the alpha agonists, they will decrease, right, they will decrease the aqueous humor production. Next, now what are the drugs, right, what are those particular beta blockers? Those beta blockers which have been approved in the treatment of glaucoma are, like we have timolol, bitoxolol, then we have levobitoxolol, then we have levobunolol, cartiolol, and then metipronolol. So these are the beta blockers that have been approved for the use in glaucoma. Now, among all these beta blockers, remember it is your levobunolol which is longest acting. Right? Remember this point. Levobunolol is the levobunolol is the longest acting beta blocker which is used in the treatment of glaucoma. Whereas you take the betoxolol, right, as already I have discussed, this betoxolol is cardioselective beta blocker, therefore less efficacious but very much safe in asthmatics, right? So betoxolol is cardioselective. Okay, so that is the reason why it is less efficacious, right? Less efficacious but safe in asthmatics, right? Safe in asthmatics, right? That is a very, very important point. Next, now the other group of drugs, one is your beta blockers, which are the first line drugs in the primary open angle glaucoma. The other group of drugs are the prostaglandin analogs, right? So prostaglandin analogs, right, if you take these prostaglandin analogs, they include the PGF2 alpha, right, the prostaglandin F2 alpha. Whenever this prostaglandin F2 alpha is being stimulated, right, that will increase, or the PGF2 alpha will increase the uveoscleral outflow. Right, will increase the uveoscleral outflow. Now we have a group of drugs which are derivatives of the PGF2 alpha. The derivatives of the PGF2 alpha are, now let me tell you the derivatives of this PGF2 alpha. These derivatives, they include latanoprost, okay, and the other derivative is bimatoprost, right, the bimatoprost, and the other drug is uniproston, right, the other derivative or the other drug is uniproston. So these are the PGF2 alpha derivatives which are used in the treatment of glaucoma, right, which are used in the treatment of glaucoma. Now a point you should remember is, presently in case of primary open angle glaucoma, these are considered as, right, which one, the PGF2 alpha derivatives, these are considered as the drug of choice for primary open angle glaucoma. Okay, so right, these are considered as the drug of choice for primary open angle glaucoma, right. Now let me tell you one very important point about the bimatoprost. You take this bimatoprost, what this bimatoprost will do is, it will increase or it will cause the growth of the eyelashes, right. So this bimatoprost, remember, it will increase the growth of eyelashes. Now because they cause the growth of the eyelashes as an adverse effect, this adverse effect of the bimatoprost is utilized for the treatment of hypotrichosis, right. So this particular bimatoprost is used in the treatment of hypotrichosis, right, where the hair growth is minimal That is what is called as hypotrichosis. So in that particular hypotrichosis, the bimatoprost is used. Why? Because it has an adverse effect which causes the growth of the eyelashes. Right? Remember that point. Next, apart from this, the beta blockers and the prostaglandin analogs, that is PGF2 alpha, then we have the alpha agonists. Right? Then we have alpha agonists which are used in the treatment of primary open angle glaucoma. Now let me tell you this particular alpha agonists. Now, the other group of drugs in the treatment of the primary open angle glaucoma are the alpha agonists. Right? They are alpha agonists. Now, if you take this particular alpha agonists, they include the non-selective alpha agonists that include the dipivefrin, right? Dipivefrin. Now you take this particular dipivefrin. Dipivefrin, it is actually the prodrug of adrenaline. Right? It is a prodrug of adrenaline. Next, the other drug is the adrenaline itself. Right? The other drug is the adrenaline itself. So your dipivefrin and as well as adrenaline, they act by increasing the trabecular outflow. Right? So what these two drugs will do is, these drugs will increase the trabecular outflow. Okay, right? They will increase the trabecular outflow. So thereby the intraocular pressure decreases. Whereas we have selective alpha 2 agonists. The selective alpha 2 agonists, they include ipaclonidin, right? We have what is called ipaclonidin, and then we have another important drug which is called brimonidin. So remember, this particular ipaclonidin and as well as brimonidin, both of them, they are selective alpha 2 agonists, right? What do? They act by decreasing the aqueous secretion, right? So these drugs, they will decrease the aqueous secretion. All right, next. But the point what you should remember is, both of these drugs, that is ipaclonidin and as well as brimonidin, both of them, these drugs will cause drowsiness. Right? Both of them, they will cause drowsiness. Now apart from that, right? Apart from that, you take this ipaclonidin. Ipaclonidin can cause lid retraction. Right? It will cause lid retraction. Right? These are the adverse effects. Whereas you take the brimonidin. Brimonidin is associated with the development of anterior uveitis. Right? Anterior uveitis. Okay. So the selective alpha 2 agonists which are used in the treatment of the primary open angle glaucoma are ipaclonidin and brimonidin. Both of these drugs will reduce the aqueous humor production. Both of these drugs, they are associated with the development, or both of these drugs can cause drowsiness. This ipaclonidin will cause lid retraction. You take brimonidin, it will cause anterior uveitis. Now you take this dipivefrin. Let me tell you the adverse effect of the dipivefrin. Remember, dipivefrin can cause cystoid macular edema. Right? It will cause cystoid macular edema. Right? So that is what is the dipivefrin does. Now apart from this particular alpha agonist, the other group of drugs, right? The other group of drugs which are used in the treatment of the primary open angle glaucoma are the carbonic anhydrase inhibitors. Right? We have carbonic anhydrase inhibitors. Now, so if you take this carbonic anhydrase inhibitors, The examples of these carbonic anhydrase inhibitors are, we have one oral formulation which is called acetazolamide. Right, this is the oral formulation. Then we have topical formulations. The topical formulations are brinzolamide and as well as dorzolamide. Okay, so this brinzolamide and dorzolamide, they are applied topically into the eye. So these carbonic anhydrase inhibitors, what do? They will decrease the aqueous humor production. Right, they will decrease the aqueous humor secretion. Next, so by decreasing the aqueous humor secretion, the intraocular pressure will be reduced and thereby the optic nerve will be preserved. Next, apart from this, we have the other group of drugs which are miotics. Right, we have the other group of drugs which are miotics. Now if you take these miotics, the examples of these miotics are mainly the pilocarpine and as well as physostigmine. Now you take this pilocarpine. Okay, so if you see this pilocarpine, remember, it is a directly acting cholinomimetic drug. Right, it is a cholinomimetic drug and it is a directly acting drug. Okay, next, the other miotic which can be used in the treatment in primary open angle glaucoma is your physostigmine. But if you take the, right, if you see the physostigmine, it is an indirectly acting cholinomimetic drug. Right, it is an indirectly acting cholinomimetic drug. So now what these miotics will do, that is your pilocarpine and as well as physostigmine, both of these drugs, they will increase the aqueous outflow by causing meiosis. Okay, so both of these drugs, what they will do, they will increase the aqueous outflow by causing meiosis. Okay, so by causing meiosis, they will increase the aqueous outflow. Next, now you take these two drugs, that is pilocarpine and physostigmine. Remember, the pilocarpine is a short acting drug. Okay, so the point what you should remember is the pilocarpine is a short acting drug. Therefore, this pilocarpine, it requires frequent daily dosing. Why? Because it is a short acting drug. Alright, next. Now let me tell you some of the long acting cholinomimetics. These are rarely used. Let me tell you those drugs. We have other drugs that is called as demacarium, right? So we have what is called demacarium. Alright, so demacarium and as well as the other drug, that is ecothiopate. Ecothiopate, it is a organophosphorus compound. Organophosphorus compounds, majority of them, they are used as insecticides, right? But the only drug which is used for therapeutic purpose is the ecothiopate. So you take this demacarium and as well as the ecothiopate. Both of them, they are long acting cholinomimetics. Right, both of them, they are long acting cholinomimetics. These drugs, they are rarely used. Why they are rarely used is because remember, these drugs, that is demacarium and as well as ecothiopate, they will accelerate the cataract development. That is the reason why they are rarely used, right? So these drugs, they will accelerate the development of cataract. right? They will accelerate the development of cataract. So that is the reason why these drugs are rarely used in the treatment of glaucoma. So let me shortly revise the drugs used in the treatment of primary open angle glaucoma. Right, we have already discussed the beta blockers and as well as the PGF2 alpha derivatives. The other drugs are alpha agonists, that is dipivefrin, which is a prodrug of adrenaline, and as well as adrenaline. Both of these drugs will increase the trabecular outflow and thereby reducing the intraocular pressure. And you take this dipivefrin, dipivefrin is associated with the development of cystoid macular edema. Then we have selective alpha 2 agonists. The selective alpha 2 agonists, they include apraclonidine and as well as brimonidine. Now both of these drugs, they will cause drowsiness, but whereas you take this apraclonidine, it will cause lid retraction, whereas brimonidine, it will cause anterior uveitis. Now both of these drugs, what they do, they will decrease the aqueous secretion. Next, the other group of drugs used in the treatment of primary open angle glaucoma are carbonic anhydrase inhibitors. If you take the carbonic anhydrase inhibitors, what do? They will decrease the aqueous humor production. The drugs are the oral formulation, we have acetazolamide, the topical formulation, that is brinzolamide and as well as dorzolamide. Then we have the myotics. Myotics, by causing meiosis, they will increase the aqueous outflow and thereby reducing the intraocular pressure. The drugs are the pilocarpine, which is a short acting drug and it is a directly acting cholinomimetic. But you take the physostigmine, it is an indirectly acting cholinomimetic. The other drugs are demarcarium and as well as ecothiopate. Both of them, they are long acting cholinomimetics. But these drugs, they are rarely used. Why? Because they will accelerate the development of cataract.